This is our first response kit orientation. On the top pocket here, we find our diagnostic equipment management. In here, we find our stethoscope, blood pressure cuff, pediatric and adult. We also have blood glucose meter and strips, clothing shearers, pupil torch, tympanic thermometers, and also we have covers in here. In this pocket here, ICP paramedics store their drugs in it, so I'll leave that pocket alone. In here, we store our ethyl chloride spray, our C-spine lanyard, and also MS's bags. In this pocket here, we have a hypoclemia management pocket. In here, we find our oral glucose. We have our 10% glucose, 500 mils or 60 mils syringe. We also have giving sets and glucagon. In this pocket here is our hemorrhage control management. We have our compact tourniquets, crepe bandage, roll-up, combined dressing, gauze, stereo stripes, and also our saline. In here, the top pocket, we have our pain relief medications. We have ibuprofen, Rotidine, ondansetron, tramadol, paracetamol, and also our methoxyflurane. In this pocket here, we find our airway adjuncts. We have OPA, NPA. We also have the laryngoscope handle and plate, and should be a biohazard yellow bag in here as well. In this pocket here, we have a nebulizer mask, both pediatric and adult. We have tubing as well. On the side, we have our airway medications. We have adrenaline, salbutamol, and ibuprofen. In this main component, we have our shop container sliding sheet. We also have IV roll, IV lines, and IV fluids. We will have adult ventilation bag kit. We also have child ventilation bag kit. We also have neonate BVM, our LMA for intensive care paramedics. We also have a towel and cardboard spins, and I have a C-spine collar. That's all. This is our oxygen bottle. To make sure it's oxygen, is a full wide cylinder with oxygen label on it. Also have 3 holes here where the regulator goes. This is our regulator attached to the bottle. First, we have to check the Bodex seal if it's good to use. Now it's good to use. To attach the regulator to the bottle, we have to line up 2 prongs here inside the 2 holes here and tighten up. To check how much oxygen is inside the bottle, we have to turn the top lid on and see how much oxygen inside the pressure cage. We administrate oxygen to patients with less than 94% of oxygen, also have respiratory distress, carbon monoxide poisoning, and also have traumatic brain injury. Now I'm going to use nasal prongs to deliver oxygen to my patient here with GCS more than 12. Nasal prongs deliver oxygen with flow rates of 2 to 4 liters per minute. Now let that 2 liters per minute go and lie the bottle down for safety reason. After my patients use the oxygen, you have to remove the nasal prongs from the patients. You have to untighten this part and then remove it from the face of the patients. And now you can turn off the flow rate and remove the tube from the bottle. To depressurize the bottle, you have to turn off the bottle and then open up the flow rate to let the oxygen go out. Now it's done. Turn it off and then remove the regulator from the bottle. This is our suction unit. First, we have to check the compartments of our suction unit. We have our canister here, suction tubing, suction feeder, we have water, and we also have to check the battery in here. Now we know the all compartments are here. First, we have to check the pressure and the battery of the suction unit if it's okay to use. First, we have to pinch the suction tube, press the test, and turn it on. You can see the lines of pressure coming up here and also the battery. You know the pressure, the suction unit is okay to use when it's turned on by itself. Now we know the suction unit is okay to use. Um, we use suction unit to remove fluids or liquid from the obstructed airway, and we also have 3 rules of using suction unit. We only insert the feeder inside the airway as far as you can see. Um, Suction circular motion on your way out, and also not more than 10 seconds. We also have soft suction catheter used on moving ambulance, and also pediatric patients and patients with inserted OPA and NPA. Um, Complications of using suction unit is bradycardia, laryngospasm, soft tissue damage, hypoxia, and aspiration. Now I'm going to use the suction unit to a patient with a GCS below 8. First, we have to turn the suction on, put the patient on the recovery position, do a quick finger sweep, and insert the neck feeder inside the airway as far as you can see, and block the hole here, and suction on your circular motion on your way out with not more than 10 seconds. This is a back valve mask, or BVM. BVM used to patients that do not breathe or breathe adequately. Components of the BVM: we have the face mask here, we have the filter, the PIP. The PIP only used to patients that cardiac arrest or pneumothorax. Also the BVM chamber, the oxygen bag, and oxygen tubing. BVM delivers oxygen with the flow rate of 10 liters to 15 liters per minute. When ventilated person, use the C grip, the single hand C grip, and you only ventilate with 3 fingers, pressing the 2/3 of the chamber. If you feel like the ventilation was still a bit leak, you can use the double-handed C grip, and you can ask the coworker to ventilate it for you. Complications of using BVM to patients include hyperventilation and inflation, trauma, gastritis inflammations. Difficulties to using BVM to patients is mask heel, beard, obesity, obstructions, age, no teeth, stiff, and stiff. Now we're going to use the airway chunks to protect an unconscious patient's airway. First, we're going to use the OPA. OPA used to patients with a GCS score less than 8, a motor score less than 6, or a comprehensible sounds to pain. To measure the correct size of the OPA is measured from the side of the mouth to the mandible. The correct inserting of the OPA is inserting upside down, halfway, and then twisted 180. You have to be careful and protect the soft tissue damage. Complications of using OPA to patients is damage to the oropharynx, emesis, induced vomiting. OPA might be too small or too big, or soft tissue damage. In any incident and we can't access to the mouth, we can use the nostril using the NPA. To measure the correct size of the NPA is to measure from the side of the nostril to the mandible. After that, we have to lubricate the nostril for easy inserting. The correct inserting of NPA to the nostril, you have to find the largest nostril and insert it perpendicular to the face and straight down. Complications of using NPA to patients is when it causes bleeding, polyps, or a severe hit. This is our life pack 15. At the beginning of every shift, we have to check our diagnostic equipment. All the compartments are here, and also run a operation notice, see if this life pack is okay for today's shift. On the side pocket here, we have our AED pads. In this pocket, we find our shock box, 12-lead ECG, cardiac arrest medication, GTN, aspirin, and also razor and spare electrodes. On the side pocket here, we normally put our Wi-Fi box in it. In this pocket, we find our 3-lead ECG. In this top pocket, we find our entitled CO2 for ICP paramedic. We also find our SpO2. The bottom pocket, we find our blood pressure cuffs for both pediatric and adult. We also store our spare paper roll in here. Underneath this pocket, we find our battery. To check the energy of our battery, just press this button here and you can see the energy light. To change the battery, just press the side lead and remove the battery. To put it back, and then push it so you can hear click. In front here we have our paper roll. To check our paper roll, if there is enough for today's shift, just lift up the bottom lid and then put it back. You can see we have enough paper roll for today. Now we can push it back and hear that click. Now it's okay. Now I'm going to demonstrate the running a user test and also changing from AED mode to manual mode, and then manual mode back to AED. First I'm going to turn the life back on. It will go straight to AED mode.
Push
now
analyze, connect electrodes.
Change it into manual mode. Just press energy select. It doesn't matter which arrow you press. It will come to enter manual mode. Now press yes. I'm gonna reduce the joules down, so because I'm gonna do a shock box test in a moment. I'm gonna put it down in 100 joules. Now I'm gonna run a user test. Just press option, go to user test, and it will run a user test by itself. It will print it out, pass or not. Now I have time to change the shock box from our pads. As you can see, it printed out. This life pack is passed for today's shift. Now I'm gonna do a shock box test. Gonna press charge, and it will charge, and I'm gonna deliver a shock. You can see that the shock delivered when it says energy delivered on here. To disarm a charge, press charge, and you disarm it. This button, disarm a charge. Now we're done with the shock box. We have to put the pads on for just to maintain our pack here. To put it back to AED mode, just press analyze.
Connect electrodes.
AED mode. I'm going to demonstrate the use of SpO2 and also the free lead ECG using the LifePack 15. The SpO2 measures the peripheral capillary oxygen saturation, the amount of oxygen inside the blood. As you can see on the screen here, it comes up here, the reading of the SpO2. If you want to print the reading, just press print. If you want to stop the printing, press print again. If you are doing CPR and you want to listen to the metronome, just press the CPR button and it will the metronome will come up. If you want to stop the metronome, press the CPR again and go to stop metronome. The free lead ECG measures the heart rhythm, but we don't have the electrodes to use it. Now I'm going to demonstrate where you attach and use the demo mode for the screen display. The lead goes to the right arm, left arm goes to the left leg, and the right leg also attached to the wrists and the ankles. Now I'm going to turn it off and put it into demo mode. First I have to remove the AED pads, also the SpO2 and the free lead. Turn it on, press the home button and event button at the same time. It will go to demo mode. Now the demo mode shows the three readings: the heart rate, the oxygen, SpO2, and also the blood pressure. To if you want to change the view on the size of the reading, you can just press lead 2 and go to the size, and you can make it bigger. To go back, just press the home button. If you want to hear the heartbeat, just go select the heartbeat here, go to QRS volume, and then turn it up. You can hear the heartbeat while you are working on other things. If you want to set the blood pressure interval, just select the blood pressure button here, go up the interval. If you want to 5 minutes, 3 minutes, I'm going to select the 5 minutes. So now I can work on other things and a 5 minutes interval for blood pressure measurements. I think that's all for the LifePack 15. Thank you.